All right, guys, welcome back to the Intellectual Coaching Podcast. Today we are joined by our guest, Dr. Griffin Love. Griffin, talk to us a little bit about what you do and your background in physical therapy.
So I am, like you said, doctor of physical therapy. I've been doing it. I've been out of grad school for about 2 years. I started out in like a typical in-network outpatient clinic, seeing total hips, total knees, some athletes that were coming in there post-op. But about a year ago, probably a little over a year ago, I transitioned into a out-of-network role. So there's me and one other guy. We're kind of partners in it, and so we do a lot more. I'd say second stage rehab now, which is glorified strength conditioning. That's pretty much what it is. So like a lot of people will come in, let's say whether it's CrossFit, whether it's bodybuilding, whether it's powerlifting, so like whatever their mode or their stimulus of working out is, they'll come to us and we'll try to figure out from a movement standpoint what's going on, what's causing us to break down and have these things pop up, and then kind of address it, nip it in the bud. And that way, from a training perspective, they're down and limited as little as possible, and they can get back into training and getting that training intensity high again, like I said, with minimal downtime. So that's pretty much kind of how, from a treatment philosophy, I'd say that's kind of how we gear things in this setting. And so we're very, very, very performance heavy. Like it should be strength conditioning in our setting.
That's awesome. Yeah, I love that. And obviously you've been a member at No Limits, in the past before moving away,
Mm-hmm.
and so we know how you like to train, and I'm sure you're far more passionate about working with people that really want to train hard as well, right? So as kind of personal trainers, I guess our biggest struggle is often getting people to do the nutritional side of things, right? Is to focus on eating better, focus on sleeping better. And then for you, the people that you see probably have that dialed in, but you're trying to hold them back from training really hard when they're still hurting, right? Is that something that you kind of struggle with higher level athletes?
Yeah, I mean, it's a lot of people don't have like I call it a dimmer switch. Like it's hard to dial it back. Either it's on or it's off. And so I do struggle with that some, but I think it's getting them and putting it into perspective. It's like, okay, so somebody comes into me and has been dealing with this issue. At this point, it's chronic. It's 6 months. It's just really impacting their ability to like get after it. And like, let's just say shoulder issue. And so they can't do any pressing. They're very limited with that. And so it's like, oh, it starts to feel better. It starts to hurt. It starts to feel better. It starts to hurt. Like it just, they're never ever really able to get traction and kind of get into a program and stay healthy long enough for it to be there. And so it's like, would you rather just spin your wheels and go down that road for 6 months? And like, I'll tell people that on day one. It's like, they'll come in and I'll say, do you want to do it this way? Or do you want to say, okay, we're going to take a back seat for 6 weeks, not take it off, but just limit. I'm going to put the reins on you a little to allow that tissue to heal, be respectful of it, give it time to actually go through these physiological changes. And then we can start to get back into what you want to do. So I would say like that is a roadblock. But again, I think it's how you approach things. For me, it's like, here's our two options. You can either keep doing what you're doing and keep spinning your wheels and be stuck in the same place, or we can take a different route and potentially get there a whole lot faster than we would if we just stay where we're at. Yeah, I mean, that would be my opinion on that.
Yeah, so basically just take your medicine, right? It's like
exactly
injury is there, not going away. So, you could either just stay injured or we can fix this, but it's going to require that you actually listen to what I tell you to do, right?
Yeah, exactly. Yeah, I mean, there's no other way around it. You've got to take your medicine. You've got to, again, it's not that like, I think from a physical therapy perspective and like rehab, quote unquote rehab perspective. Too many people are like, oh, well, my shoulder hurts. All right, well, just don't do any overhead pressing for 8 weeks, right? Like, that's not what I'm saying. You can still do pressing. You can still, if these are not symptomatic movements, then that's the last thing I'm going to tell you to do is just take it away. It's like, oh, well, I have pain when I'm trying to do a lateral raise. Okay, so maybe we need to drop it down, and if it's a full range concentric movement, maybe we just stick to isos and then put you in that lateral raise, and that feels better. You're still getting some sort of stimulus for the delt. You're still getting engagement of all the rotator cuff and everything that surrounds the shoulder, but we're not necessarily loading it to the point where it's having to stabilize throughout a greater range and a greater degree of freedom. So that's where, like, it's really important saying it's not that we can't do these things. It's just for you, the best thing right now is to maybe switch it up or change, like I said, like manipulate the variable a little bit. It might not be what you exactly want, which is to friggin' throw around heavy weight overhead, but it's going to be the next best thing to get us back as fast as possible.
That makes a lot of sense. So I'm curious. So obviously we work with a lot of bodybuilders, a lot of lifestyle clients. Like, I'm sure you've worked with a wide variety of different clientele. What are like the big, most common injuries that people come to you guys with? And like, tell us a little bit about what that looks like and how you guys approach that.
So especially for active population, it's knees, like patella tendonitis, quote unquote. It's just like patella tendon irritation, shoulder, rotator cuff issues, low back. Low back is just crazy. It's everybody's got it because nobody really knows. Very few people take the time to actually learn muscle recruitment patterns and strategies. Like, I wouldn't expect anybody to, like, just off the top of their head know what those are. And so it's like, yes, you could be doing something for 10 years and do it really well, but it doesn't mean that necessarily, like, once we exceed a certain load, that technique, that movement pattern will break down, and then you can't go past that. So for me on day one, like, that's super huge in, okay, are we getting those right strategies? Are we recruiting in the right way to allow us to continue to build these like brick by brick by brick onto it, and that wall not come crashing down? So like I said, shoulders are huge, backs are huge, knees are huge. Even like for us, there's a decent amount of runners in the area, so we get quite a few marathon, ultra runners, and so plantar fasciitis is a big one. Because, like, how many people do you know that truly take into consideration, even in bodybuilding, like foot strength, like really hammer in, like foot intrinsics, ankle intrinsics, or ankle stability and calf strength? Like, yeah, we might do calf raises in like these bigger muscle groups for muscle development, but we're not thinking like from a baseline stability for us to have that ankle and then foot strength that then allows for up the chain recruitment for the calf, for the knee, the hip, even the back, even the shoulder, dude. Like, it's crazy.
Yeah, that makes a lot of sense too. So would you say with the majority of people that you're dealing with that it's caused by training or by lifestyle factors or a combination of both?
Multifactorial, like all of it. I mean, I know me and Nate had a conversation the other day because I dug 18. I had to plant 18 trees in the backyard. Like that impacts your training. But then it's like, okay, well, if I go play a golf tournament and let's say I don't practice a ton and like I've got a ton of stiffness in my ankle and my lat on the left side, like that's going to affect my training. So then again, if I'm not aware of that, not doing mobility stuff, not addressing that impairment, not that I got hurt, but it's just like you use more on one side than the other. So when you go train, yeah, you're going to be more fatigued on one side. So you're more apt to, if you're doing the same load, one's more fatigued than the other, yeah, you're going to be more apt to recruit in a different pattern or a different strategy. So if I'm training my back, my lats fatigued, then yeah, I'm going to get a lot more pulling from like teres major and like these smaller rotator cuff muscles and things that help me complete the task, although it's not necessarily in the best strategy for muscle growth and hypertrophy.
Yeah, no, absolutely. I think it's like obesity, right? It's not as simple as eat less, move more. There's so many different factors at play. It could be your financial position, it could be your career, it could be having a family. It's like there's all these things at play. And from my experience, I think a lot of people, they just don't adapt, right? So when they're in their early 20s and they can get 3 hours of sleep and they can hit PRs and they can go out drinking, be hungover and still train, and then they get into their 30s and 40s and they're like, well, why can't I still do that, right? And you start to notice the differences. So how do you deal with like the stubbornness of clients not willing to change and adapt to where they are in life at that current point in time?
See, honestly, it becomes more, and I think this is like, again, it's not necessarily a medical professional, it's trainers and coaches, like things that when you become almost like a counselor, like somebody to understand, because for me, in my perspective, like I'm so, as an athlete, right, you become so particular and so like, this is how it's got to be for like the perfect storm, or like I've got to create these perfect conditions to create the most optimal growth or strength or whatever we're training for, versus like just understanding that like life is life, and it just, you can't control all the factors, and being able to be patient with yourself. Like I tell people all the time, I'm like, stop beating yourself up, or stop, like, you had something that you can't control come up, but yet you're taking it upon yourself to feel like it's within your control when it's not. And I think that's being able to like put it in perspective for people. Like your family comes into town, or like somebody dies, like you can't control those things. Like that's a thing in life. And if you just continue to like hammer yourself because you're like, oh, my diet wasn't 100% perfect, or like I wasn't 100% on my macros or training or whatever, then like you're just going to continue to spin your wheels and be really beat down all the time, rather than be like, I'm doing this for fun. I'm doing this for enjoyment. I'm doing this to gain like momentum and create like a lifestyle change. And so like you're talking about the diet, obesity things, like I try to tell people, just get started. Like it doesn't matter where you're at. It's just like, do the best you can and then adapt on the way. Like there's things that I wish I knew in the last year to 2 years that I wish I would have known them 10 years ago. Cause like, I can't imagine how much further along that I would have been, but like, okay, cool. Like I look back and say, oh, well, that would have been cool but like, what does that change? It doesn't change anything. So like trying to get people to understand.
It's also a rite of passage, right? It's like you have to learn it as you go, because even if you think about life experience, it's there might be someone that's 40 years old telling a 21-year-old that, hey, do it this way because I promise you later down the line, these are the things you're going to experience. And they're like, oh, no, you don't know what you're talking about. I'm going to do it my way, right? It's the same thing. You can give people in the gym all the advice in the world, and they'll be like, yeah, I'm going to do it my way. And then 5 years later, they come to the conclusion that they should have just listened to what you told them to do.
Yeah, I think it's one of those. It's kind of like the conversation we had last week about like having realistic expectations, and then that's where like the life experience kind of comes into play. It's like you don't know what you don't know until you come across that stuff. It's like having kids and starting a family and all those kind of things they kind of sort themselves out to a point where it's like your expectations adjust with all those things. So I'm kind of curious with that, like kind of transitioning into like with your individuals that you have that are like really busy with family, business, things like that. What's your go-to procedure for people? Like if you're just trying to get somebody to do some sort of like basic routine before they train just to feel better, but they have like a busy schedule, they don't have a ton of time for like rehab stuff. Like what does that look like? And how do you like to prescribe that for people to kind of get them to do something before they're like moving their bodies?
I mean, I think it depends on the case, because I know you said, so if schedule is really limited, like you can build movements in to improve mobility, right? Like unless we're just training RPE 10 out of 10 all the time, like there are movements that we should be able to incorporate based off of what our goal is. And so for us, it's like, okay, if we're talking about like changing hip flexor length, you've got tightness in the hip flexors, okay? Rather than doing like a rear foot elevated split squat, I might prescribe somebody or tell somebody to do. Let's instead of that, let's just manipulate the variable a little bit and change it to like a foot on the ground split squat, like front foot elevated. So that way you're getting more lengthening for that hip flexor. You're getting it under load. You're getting it on tension. I'm not a big stretcher. Like I respectfully, I just don't enjoy it. Some people like yoga like that. Has nothing against it. It just is not my speed. And so I try to get the most bang for your buck in terms of mobility and movement. So if I can give somebody a different exercise and still accomplish the same thing, but also target what we're trying to improve that I see in our assessment we went over on day one, then absolutely. Same thing, hamstring length, right? Like RDLs, GHDs, like things like that, where you can start to challenge that hamstring, force that lengthening under long durations, and then that'll create that tissue adaptation that we're looking for. So sprinkling it into their actual lifting or their training program is, for me, the best way that I found to get adherence and consistent adherence. Like some people, they'll come in like, oh, my shoulder hurts, and so I'll give them something. In the beginning, I would give them something. They do great. They do it consistently 3-4 times a week. And then they're like, it started feeling good, so I stopped doing it. It's like 4 weeks. I'm like, okay, but at the same time, your mobility still sucks. Your functional capacity just improved. So you can press now without pain, but your mobility still sucks. And we're going to be back here in 6 or 9 months. So
yeah, that makes a lot of sense. Oh, sorry.
No, you're good. I was just going to say, just being able to build it into the actual training program has been the best thing that I've noticed to get the best results and the adherence that I'm looking for, especially for people who have 3-4 kids that are up at 4 a.m. training and then going to work till 6-7 p.m. Like, the last thing I'm going to be like, do is, oh, hey, here's the 4 exercises that we're going to do. I want you to do them 4 or 5 times a week outside of your normal workouts like that.
Yeah, and I think that's a really good point you made there with like the family schedule and stuff like that. I was just having a conversation with one of my clients the other day. He's like a new dad. His goal was like his fat loss right now. So he was like, dude, I don't know how to get my activity level up and incorporate more cardio just because of my schedule. And I was like, all right, well, let's look at your program. Let's maybe reduce some of the volume of your training, and then hammer out 10 minutes on the Stairmaster at like a pretty high intensity. So it's like you're kind of killing 2 birds with 1 stone, because like if your main priority is fat loss right now and you need to carve out more time for cardio, but he just doesn't have more time in the day. I was like, well, let's just like reinvent the wheel slightly, right?
Yeah.
Kind of get to the place we want to be eventually, just a little more effectively, still within those time constraints.
Yeah. And I will say, kind of building off that too, like that's a great point, because everybody's season, everybody's phase, like training blocks, right? Like 8, 10, 12, whatever that microcycle looks like we should be worrying about whatever the goal is at that time. Like you're saying, like aerobic training for that person is the priority. Yes, obviously we want to get bigger, faster, stronger all the time, but maybe for this phase or block, prioritizing a little bit more aerobic training. And then next time, maybe kicking that volume up a little bit more and keeping the aerobic at like a steady level. So that way he maintains that level, but he's not necessarily trying to improve it. And then going back to that later on throughout that macro cycle that year. That's another way that I try to change people's perspectives, because it's like in your typical like PT setting, people get exercises and they're like a death sentence. It's like, hey, here, do these exercises. And then it's, okay, do I do them for a week? Do I do them for a year, 18 years? Like, there's never any guidance with it, versus it's like, okay, we're going to do this for 6 weeks. And this is the change that I'm looking for. And then we're going away from it, because you've got X, Y, Z going on. Y is the most important, or the most crucial thing that we need to prioritize right now. So we're going to work on that for this block, and we're going to do that for 8 weeks. And then once we see significant improvement there, cool, okay, let's dial it back and maybe do that once a week. And then we're going to prioritize doing whatever Z twice a week to bring that level up. And so that way we're always trying to pull that organism or that person up in different areas, but not trying to overwhelm that system and just create non-adherence. Because it's like, oh, well, I've got 14 things to do. I can't get to them. Dang, I'm a terrible person. Like we were talking about earlier, I can't do that. And then they just don't do any of it because they feel bad.
Yeah. I always tell people, check the big boxes, right? It's like, get the biggest bang for your buck. If you've got 30 minutes, then do what's going to give you the highest return in that 30 minutes. Like, does it really make sense to be doing a bunch of tricep push downs when you've got 30 minutes to work out, right? It's like, well, if the goal is to just purely build massive triceps, then maybe. But, but like, for most people, that's not it, right? And then if you are a bodybuilder or an athlete, then there's going to be an expectation for you to carve out more time to be able to train. So if you're dealing with just a regular person, it's like, okay, we've got 30 minutes. Let's hammer down and get the biggest bang for our buck. But if a bodybuilder came to me and said, I only have 30 minutes, well, that's probably not going to be enough, right? Like if you're truly serious about competing and being good on stage, then you might need to be able to carve out at least 60, if not 90, right? So it's all, again, dependent upon the person and then how serious they are about the goal that they're actually trying to achieve. Griff, what would you say is the biggest mistake that you see lifters make? Like when you go into the gym as a physical therapist, I'm sure you're looking around the gym and kind of watching people train and thinking, like, I won't be doing that. So what do you think that you see most often is the biggest mistake?
Oh, that's a great question. I feel like the generic answer would be like movement patterns or like how things are executed. But I would say there's people emphasize too much, like there's too much emphasis on weight and not enough emphasis on time and like tempo. Like that in my opinion is like one of the biggest things, because from like somebody that goes into the gym and it's never worked out before, like they care, like they look at the weight, they try a weight, it's hard, whatever. But if you can really master a tempo and a control, like that's motor control, that is a neuromuscular adaptation that's occurring. Versus if you just bounce weight around, like if you just move it around, you could progress fairly quickly because you're just the speed doesn't change, the control doesn't change. All it is momentum and stretch reflex, right? Like that's a subconscious thing that your body does. And so if we can create more of an emphasis on, okay, I'm going to pause 2 seconds at the bottom, I'm going to create a 3-second eccentric, like those are things that teach you and teach your body awareness in certain positions, and that will translate over far more from a force production and a strength perspective than it is just friggin' trying to bounce a bar off your chest. And I know, like from a bodybuilding perspective too, like you can't be moving weight. I mean, it's the whole intent of it is like movement inefficiency, right? Like you're trying to load that tissue, you're trying to load as much as you can on that muscle throughout that range as you can. It's not like, okay, we're going to try to 1 rep max a squat where you're trying to move that bar as efficiently as possible. You're intentionally loading the tissue, loading the range of motion, making it a greater range so that it's challenged more, you're yielding more hypertrophy.
Sorry, go ahead.
No, go ahead.
Well, I was going to say, like, strength is earned, right? It doesn't mean that you don't load things. It means you earn the right to load it by,
correct.
I would say it's like 4 variables. It's going to be your form, your tempo, range of motion, and then load, right? So like once you've got the first 3 down, now don't piss around, load it, right? Not at the cost of then sacrificing the first 3, because that's, it's like if your progressive overload, every rep should look the same, week to week, right? So it's like if you're doing, let's say you're doing a dumbbell chest press with, let's just say 100 pounds, and the first week it's 3-second eccentric, maybe a light pause, kind of 1 second concentric and then back in. And then the next week it's a 1 second eccentric, no pause. Like that's not progression. Like you may have increased the load, but at the cost of quality repetition, right?
Yeah. Yeah. Like you're talking about, like muscle stimulus. You're trading the load for lack of muscle stimulus or like mechanical tension, because that's what you're doing. So no, 100%, because that's like when people come in here, it's okay. Usually people fall in like two areas. It's either they're hypermobile and they move way too much, and that's the reason they got hurt, or it's they don't move enough and their joints are just so stiff and their tissues are just so guarded or whatever, and that they can't get into positions, and then that results in excessive loading somewhere else. And so that's where it's like we check the boxes. Okay, do you even have the mobility and the positioning to be able to get into that, whatever we're looking for, whether it's a overhead press or a squat or a deadlift, whatever, or lunge. And then it's like, can you own that motion? If you are hypermobile and your arm just swings back, or the hip or knee, whatever, you have to be able to control that. Okay, so then do we have the motor control to own the range of motion that we have? Okay, then once we check that box, then you earn, in my opinion, you earn the right to load, right? Like that's exactly what you're talking about, is just because I tell people all the time, and respectfully, just because you can do something doesn't mean you have the right to do something. Like you could go in there and throw around a 100-pound dumbbell, but does that mean that you own that and that you can control it well enough to actually use that as your working set?
It's a very weird, because even we're all guilty of it, right? But
100%.
Your body doesn't understand 100 pounds. Your mind does, your ego does. But doing 80 pounds well, your body isn't going, well, you're not doing 100 pounds. You know what I mean? But it's like your ego says, I need to do triple digits. Yeah, like instead of going,
I want to go for the triple.
It's like I'm going straight from 90 to 100. Well, there was an increment. Why didn't you rinse that? You know, it's like, but the ego and the social media and but no one really cares, right? It's like nobody. I'd much rather see someone move well, efficiently, with quality, than just. I don't look at someone in the gym swinging around 50-pound dumbbell for bicep curls and think, oh wow, they're really strong, right? It's like I would rather see someone do it with 25 pounds, but with the right level of control, and then I would actually be like, oh wow, their form, it's impressive. Yeah. But if you're just swinging dumbbells around, eventually people are going to have to come and see you. So I guess it is good job security.
Yeah. I think that's one of the areas that, like, I know for me that my approach has changed a lot over the past few years, but I'll have clients that when I'm programming for them, whether it's in person or online, we might stay at the same load for quite a few weeks and just work on the intensity and the quality of the movement pattern before we even look at like increasing weight. It's like if someone's doing an 85-pound dumbbell in like an 8 to 10 rep range and they're still improving the quality of it from week to week and still challenging the muscle, like I don't necessarily think you need to directly jump to 85, 90 right away. Like spending a few weeks there, like mastering that weight, I think you get a lot more bang for your buck.
Yeah, 100% agree. Because like you were saying, like the body responds to mechanical tension. It has no idea what 100, what 90, what 10 pounds feels like. It's like, how well can we load mechanical tension onto the muscle fibers? And then that's what drives that change. And so, dude, I'm so guilty of that. Like when I transitioned that mindset in the last probably year and a half is when I like really thought about it. I'm like, I'm spinning my wheels here. Because like I'd go to the gym, and even when I was at No Limits, like I was training hard, but it was just stupid jumps. Like I never tracked anything. I just went in there just to move heavy weight and just push my body, and that was it. And so it got to the point where I'm like, I'm doing something wrong where like there's a disconnect. It's what I'm trying to accomplish or trying to like the goal I'm trying to achieve and my process is not aligning because clearly something's not working. So then I started like looking at it, really trying to think about it. And then so I started tracking everything. Started really emphasizing tempos, changes, like we were talking about mechanical tension. And that's when I saw the biggest jump in my life at that point. Like I saw such a change in terms of just definition, like how that muscle was developed. And it made me, I think it opened my eyes a little bit to like how, not careless, but just like we were talking about earlier. It's just, if only I would have known that 10 years ago. But it's going through those things and understanding like that's just part of the process. Like until you have lived it and done it, until you've experienced it, like you don't have that buy-in or that like true understanding of, oh, that's why it's important to do these things. So now it's understanding the benefits of that. I can translate that over to people all day, every day, and try to explain that. So that way, if somebody can understand it a year after having just worked out or 6 months of just getting into working out, they're going to get a lot more results. They're going to achieve their goals a whole lot faster than if they just kind of, oh, well, I'm just going to work out and just kind of move and like, oh, I'm doing a squat with a 10-pound kettlebell. That's going to get me stronger, right? I'm like, okay, when we first start, yes, but we're going to have to progress from there. Like, so just like we were talking about, being able to teach and educate people, that's been the biggest thing from my perspective that's changed, of being able to actually understand the importance of tension and tempo and pauses and range of motion and all these things that play a role in hypertrophy and muscle growth.
Yeah, that's a great point. That's why I think it's so important to have skin in the game. Like the best way to be able to teach is to do, right? Like you need your own training and your recovery and your own nutrition to kind of sharpen your skills and tools to portray into your own clients, right? It's like when you get that life experience, you can better teach other people how to do things by trial and error of your own training. I know for myself, like just taking an example, like a seated hamstring curl, I think last off season I was maxing out the machine and I was like, all right, where do I kind of go from here? Then I looked at my physique after I competed and I was like, my hamstrings could develop a lot better. So this off season, my approach has been dial back load a little bit, focus on the intent of the movement, and then just kind of slowly build it back up. And I think for myself, like I've seen significant growth in that part of my physique just from kind of reevaluating how I'm approaching my training to that specific muscle group. And that can be said to anything. I mean, you look at like people in the gym curling 60-pound dumbbells, they usually don't have the biggest arms in the gym. But the guys that are doing 35s with like actually quality intent and getting stimulus to the muscle usually have significantly bigger arms.
Well, I think it's also the importance of video and technique, right? Like Griff, I'd imagine that a lot of the time you get a client in a position, you take a video of them doing it so you can show them, look, this is what you're doing. This is where I want you. This is where you are, right? But I think a lot of people, they'll be making those jumps in weight and they're slowly, their form is breaking down like week to week, but they don't notice it, right? So they just assume that the progression is there. But if they were actually to take a video and, be critical about their form, they'd say, actually, I probably need to dial this back a little bit. And I think it's very important to understand that sometimes you actually have to take one step forward, one step back to take 2 steps forward, right? It's like people, well, I had to take weight off the bar, so now I've gone backwards. No, you're going forwards because you're cleaning it up. What you're actually doing is you're opening the door to make more progression long-term versus running into an injury, 3 weeks down the line because you're just overloading the movement. And now you're out of training for 6 weeks or whatever it may be, right? So, or hard training, I mean. And which actually is going to hinder your progress more than if you just backed off the weight and then progressed properly from there,
Yeah. So, go ahead.
I was just going to say, based off of what you were saying with the building training, I mean, I was running into an issue a few years ago with a lot of my online clients. They were like putting feedback in, this hurts, and then I look at the load they were using and things, and I was like, send me a video of what this looks like. And that's when it kind of clicked for me. It's like, I need clients to be sending me more footage of their training so I can actually provide more value to them and help clean it up. Yeah. Then we come in and do an in-person session together, and I'm like, oh, I see why your elbow hurts. I see why your knee hurts now. Like, this is way too like load focused, and the technique not there. So then you can kind of reverse engineer that, look back at the structure of the program and be like, all right, let's take a step back here, fix the issue, get you moving pain-free, and then we can kind of develop from there. But it's crazy how often like you'll have clients, and I'm sure a lot of your patients as well, like they complain about something, then you see how they're actually operating in the gym or moving with you, right? And it's like, okay, it paints a better picture of what's actually going on. So yeah, the video footage is like so important. Half the stuff that I film with my own training, I don't even post. I'm just looking at it to like kind of keep myself in check from ego lifting, because it's so easy to do, especially if you're trying to chase some type of like physique goal, competition or powerlifting, whatever it looks like. It's like kind of keeping your ego in check with that stuff. So
yeah, like I know, so personally, like I used to struggle from a squatting and lunge perspective. Like I used to, we were talking about, I accomplished the goal of doing a hack squat, pendulum squat, whatever. But when it came to like stimulus for muscle growth for my quads, trash. It was awful. Like I could never, I would look at these dudes who'd have massive quads. I'm like, how do I, like, why don't they look like that? Like, what am I doing wrong? And again, like I was saying, you're explaining it perfectly, like taking a half step back in order to take 2 steps forward, because I literally had to drop almost all the weight, like literally to 1 to 1.5 plates on a hack squat, and like force my body to understand that I've done a movement not poorly, but to emphasize different things for 10 years, 12 years. Like I've gotten so much more glute ham recruitment and less quad than I have if I just drop that weight, force my knees over my toes, and like really force that stretch, force that deep knee flexion, and then move from there. But then, like you were saying, like I've got to go backwards and drop from whatever 3-4 plates to 1.5 to actually figure out, like teach my brain and my body to coordinate that movement differently. And then from there, I can slowly progress it. But then we were talking about, this is where I'm going to pull out the PT card, because it's like, okay, you're loading your tissue in a completely different way, in a different method that it's ever been loaded before. So if I try to go from what I would used to have done was 1.5 plates, 2 plates, 2.5, 3. And then we're back to square one and moving the exact same way that I did 3 weeks ago, and without getting that new recruitment strategy or that new movement pattern. So being able to like just say screw the ego, screw whatever, and just I'm going to take this period of time and train my body differently and teach it what it needs to, because I know that what I've been doing doesn't work. This is the only way to get to where I need to be. And then a year and a half later, like I'm doing a decent amount of weight, but I'm still having it's still a challenge as I get heavier to not just try to keep the knees back and go more into my hips. So it just, like you said, take a step back, humble yourself. It doesn't matter. Like nobody cares how much weight you're doing. Respectfully.
Like, I mean, if you're a powerlifter, you know, that's what you measure. But as a bodybuilder, like when you step on stage, nobody says, hey, your physiques are really close, so we need to know who can lift the most. Right? Like it is interesting how we become so obsessed with that, you know? Griffin, you said something there that I wanted to remember. Is like you talked about, you know, getting your knees over your toes, which I feel like bodybuilders have probably been doing forever, right? It's like sometimes I feel like bodybuilders are ahead of the curve, or they just do it because it feels right, and then all of a sudden it's like that's what you should be doing. Right. For a long period of time, it was like never put your knees over your toes. It's terrible for your knees or whatever. And now it's gone to like get your knees as far over your toes as you can. How often are you dealing with people where you're trying to debunk, you know, previous myths or things that used to be that now aren't, and it's changed, the science is different? Do you find yourself dealing with that a lot?
A lot. I would say probably like 25-30% of the time. So like a good amount. So another one, so knees over toes is a big one. Never rounding your back ever. That's another huge one that like everybody is like,
I
thought you.
Packs to blow out. Like, yeah.
What else? Those are the really, really big two. I mean, I'm sure there's quite a few others that I'm missing, but like, yeah, it's just, again, when I was going, even through grad school, like when I was going into that, like some of the traditional professors and things and clinicians were like, oh yeah, like you want to be in this position, like, and everybody's genetics are different. So like, why would you just generically tell everybody to be in the exact same position if somebody's femurs and tibias and back and all that are different sizes, and that's going to translate different forces in different areas, and so you're going to have to look differently than those other people. And so that's when that made me start thinking, I'm like, so if we stay in one position, it's like if you were to do let's say let's just say a dumbbell shoulder press, and you're pressing in a certain movement pattern, right? Up and down, up and down. What happens as soon as you get heavy or get fatigued and you move out? You're probably going to get hurt because you've never moved into that position and had to be there. So rather than thinking of it like, okay, we have to stay in one place or else the world's going to implode, like, we've got to train the body and be resilient in all of these positions. I'm not saying that there's not a loading pattern or loading strategy and a movement strategy that we want to have. Yes, there is. Am I saying that you should deadlift with your back completely rounded? No. But like, should it be strong that you could load 40, 50 pounds with a flexed spine? Absolutely, because you probably do it at home 15 times a day. Yeah. Right? Like, you go pick up a case of water, unless you're a lifter, like most, I don't want to say regular people, but like people who are less apt to go to the gym, go pick up a case of water at Costco, yeah, they're going to probably round their spine some. And if you don't have the strength and the resiliency to stabilize that spine in that position, you're going to blow out a disc just coughing or sneezing. So yeah, getting the knees over the toes, loading that tissue, loading that tendon at that specific joint angle, as well as same thing with the spine, getting the spine rounded and flexed and rotated and loading it there, loading it within a progressive overload model as like you would do your quad or your hamstring or your calf.
Yeah, spot on. I love that.
Yeah, that's good. One thing I did want to kind of dive into you today, and I think nowadays with like social media and all the information out there, good and bad, the recovery side of things is like it's whole industry. There's a whole industry to that now, and all the wellness things. What are some of your philosophies and approaches on the recovery for high level athletes, lifestyle people? What does that look like in your approach for that, and how do you describe that type of stuff? What are your thoughts there?
So in terms of like, let's say body work, cryo, red light, like that kind of recovery stuff.
That whole room. There's so much depth to that kind of doing.
So my opinion is, and I'm going to be super generic, but Will hit it on the head right when we got in here, because it was, if you're training hard, you're eating, you're sleeping, you're doing all the things, like you're hitting that 90, let's say 97%. The other should complement it, but it's going to impact it. Like you said, sleep, that's going to be oh my gosh, that's so crucial from a research perspective on how your body is going to recover week to week, month to month, and even throughout the year. Like that diet, nutrition, like yes, when you're in a deficit, when you're in prep, like it's going to be hard to recover. That's just the name of the game, right? Like there's nothing you can do. But I think it would complement it, but I think there's far, far, far too much emphasis of like, oh, go do cryo, do red light, do weekly massages and get your cupping and like do all these things. Because if your program is appropriate and you are doing what you need to be doing, and you're not training like an idiot, as we talked about, like you shouldn't be needing all of those things unless you are trying to win the Olympia, right? Like all those things. Yeah, somebody like that might help 1%. Cool. That's fine. If you're in prep, you want to do those things, it will help offset what you're not getting from a diet and probably a sleep perspective. But I think it's too much of a hot topic or like a fad right now of all these things. And I just don't think there's enough research to show that there's that much bang for your buck.
Yeah, we're 100% on the same page there with that. I was actually just having a conversation with a client about this the other day. And I view this the same way I view like certain supplements. There's a supplement for everything nowadays. But I'm just big on the basics. Like if your training's good, your diet's good, and most important, you're sleeping well, like those are like the big boxes you need to check. And like that other stuff like supplementation, recovery work stuff, like that's like the 1%, maybe 5%. But you can't get here to the big three things first, and that stuff doesn't matter. But I think people put so much of the emphasis on tons of money in all these other areas, and we're just looking at the big like the big so far.
It blows my mind at how many people think that they can do everything off no sleep. Like it blows my mind how many people think like, oh, I get 5 hours and I'm fine. No, you're not fine. Like, I have got used to just getting by on that amount, but literally every study, all the research shows that like anything less than 6, you are basically operating at like half of your capacity. I mean, your cognitive function, you're more at risk of getting in like a car wreck because you just can't make the right decision.
Processing speeds,
properly, you're definitely not going to recover. I mean, all of it. You know, your testosterone levels are going to be massively impacted. It's just nothing beats 8 hours of quality sleep, right? It's like it is the best recovery tool that we have. And I get, listen, I get it. I got 3 kids, and like there's phases where you aren't going to be able to get that, and that's okay. But like you don't then try and live the rest of your life that way because you had to do it for a period of time. The goal is to get back to getting quality sleep as quickly as you can, and just understanding different.
That's why I think it's so important that like coaches like collecting data from clients. Right, how would you address this? They were crap, and there's a good chance that you're training for crap. So if you guys think about it, I feel like I'm not progressing in my list, I'm not losing weight. It's like, well, let's look at the real basic stuff. If you get any sleep, good sleep, like cover. If it was a 3 out of 10, then you can't sleep well. Your week is a 3 out of 10 across the training. Like it's simple stuff like that. I think people massively overlook. It makes all the difference when you're trying to
Yeah, because like you said, I mean, you can flaunt a research paper all you want that tells you that exact same thing, but like it's not what's sexy and it's not flashy and it's not cool. It's like we were talking about earlier, tempos and pauses and lightweight. Like you're going to yield far more result than doing what's flashy and throwing 5 plates on a hack squat and trying to like bounce that thing off the catches. Like the one's going to be flashy and look cool, but like it's not going to be as beneficial. And it's the same way with sleep, diet, recovery, training. Like those are your principles. Those are your pillars that you've got to have. And it's not cool or like trendy. It's not trendy.
Yeah, I think, you know, you get a lot of people, and listen, I like David Goggins. You know, there was a period of my life when it was really helpful to listen to that stuff. But if I tried to listen to it now, I would cringe because it's like, again, not that there's not value there, but like the average person isn't ready to throw on a weighted vest and go and run 10 miles because David Goggins says you're only 40% of the way through. You know what I mean? It's like, it's the same with like Kobe Bryant. People will be like, oh, he was at the gym 3 hours before everyone else. I'm like, I'm sure he wasn't every single day. And I'm sure he was taking naps throughout the day and had a nutritionist cooking his food for him. And he had a life set up around that. You don't, right? So it's okay sometimes. You had a really bad night's sleep to say, I'm not going to go and train today. I'm going to focus on getting a good night's sleep tonight, and then I will push my training day back to tomorrow. you know, but people think that's weak, or that they just need to tough it out, or that they need to, you know, take a really hard pre-workout and just push through anyway, right? And it's like, yeah, there might be a time for that, but the most sensible thing to do is just to recover that day, get a good night's rest, and then go at it the next day. You know, you're not losing.
Yep. Agree.
Yeah, I think that ties in full right? It's like just knowing how your week's been and self-assessing kind of where you're at and making decisions on like how hard you should push your training or you can spend all that day, depending on the parameters of what your day was like, right?
Yeah. Griff, it's been awesome, man. I got one more question for you to wrap it up, kind of a fun one. Put you on the spot here. What is your most overrated exercise and your most underrated exercise? Let's also do hypertrophy, so you're not thinking about.
Okay. All right. Respect that. Okay. Overrated. That's a great question.
It's tough, isn't it?
Dude, it's why that's tough. I'm gonna say, this is gonna be a layup, but I'm gonna probably say like a flat bench press, barbell bench press. Just overrated.
That's a good answer. Yeah. That is a good answer. Yeah, and there's probably going to be a lot of people on here that go, "I built a massive chest," you know. And he's not saying you can't, but there's better options, right? So
correct.
No, all right.
Underrated. Let's go with. A lot of people hate them, but I'm going to go with a front foot elevated split squat. I love that from an ankle perspective, from a foot perspective, from a hip, from a shoulder. Like you can argue that the benefits from it, from a mobility perspective, from a strength perspective, stability, power, like all those things. There's an argument for. So I'm gonna just say
so many boxes.
Yeah, cardiovascular.
100%.
Okay. One more question just to add on to that.
Yeah.
Then we're big fans of always having something unilateral, you know, in a leg day, even if you're a bodybuilder, because I know there's bodybuilders that will just hop machine to machine to machine. This is optimal for hypertrophy or whatever, right? But I'm a big fan of having unilateral work in there somewhere for pretty much all the reasons that you just explained. It checks so many boxes. Would you agree with that?
Absolutely. And again, this will be quick, but like this kind of goes into the programming and the finesse side of things. But like you can't have somebody be doing 6 unilateral movements, right? Like they'll be there forever if they're doing 3 or 4 sets. And so like there's
it gets redundant.
And so, yeah, exactly. So from a perspective, you need some sort of unilateral movement for everything, for push, pull, lower body push, lower body pull. But at the same time, I think being able to manipulate that variable will give you, depending on what that person needs, it'll accomplish so much. So being able to throw in 1 or 2 unilateral movements is going to create that stability that you might not get, that perturbation, even from a spine perspective. You're getting like your multifidi, your rotators, all of those spinal muscles that are stabilizing while you're doing a row or a pull or a leg press or whatever. So you're yielding so much that you don't understand necessarily. It might not be the most optimal from a hypertrophy standpoint, but guess what? If it's more stable when you're doing the bilateral or double leg work, double arm work, you're going to yield more because you can create more force production, more mechanical tension, and you're going to yield more because you're more stable. So, like, it's not directly helping the hypertrophy, but yes, it really is.
I love that.
Yeah, checks a lot of those boxes. Well, Griffin, this has been awesome, dude. I know you've got a busy schedule and a family, so we appreciate you taking some time to jump on the podcast with us. I'm sure our guests got a lot of value out of this conversation. What's a way for people to find you on the plug yourself on the social media for us?
I think it's Love Fit.
No. We lost audio there, man.
Lost the audio.
We'll add it in.
We'll add it in the bio.
Cheers, Griff.
All right. Thanks, Griff.